You are welcome once again, and this is the second video lecture on our introduction to anatomy and physiology. Homeostasis. Homeostasis is a stable internal environment, and every organism must maintain this homeostasis for survival. And its regulation is responsible for keeping internal environment within certain limits. What are the internal environment that must be kept within certain limits? They are temperature, blood pressure, glucose level, and etc. Also oxygen and carbon dioxide. For example, glucose. How can glucose be maintained within the certain limits? There's always a level of standard level of blood glucose in the body. But when we eat our starch or carbohydrate, the end product of starch or carbohydrate is glucose, and when we eat this kind of food, it increases the level of blood glucose. But body will not leave the blood glucose to become higher than normal limits, which may lead to diabetes. That is why too much of blood glucose or too much of glucose in the blood will signal the pancreas to secrete or release an hormone called insulin. This insulin will now be the one that will now work with the liver so that they will be converting some of the excess glucose in the blood into glycogen, so that all the excess glucose will now be reducing till they reach the normal limit, and they will now be stored in form of glycogen back into the liver. And also, when there is also a need for glucose in the blood body again, what happens is also that homocysteine also come up by making sure that they will not allow the glucose level to come down, because there must be a certain limit they must maintain. So when the blood glucose is now reducing from the normal limit, that at the same time again another mechanism will come up in which this low level of glucose will sense the pancreas to release another hormone called glucagon that will also be converting those glycogen that has been stored due to excess blood glucose before, will now be converted back to glucose. So that glycogen will now be converted back to glucose in order to increase the level of glucose in the blood to the normal limit, which means what happens in the homocysteine is that it helps to maintain the level, so that when the thing is getting higher they bring it down, and when it is getting lower they also bring it up. And there are two general points within homocysteine that we have to note. One is auto-regulation or intrinsic regulation, and the second one is extrinsic regulation. Auto-regulation, from the word auto, is one that occur when cell, organ or system adjust its activity automatically. That is auto-regulation. While the second one is extrinsic regulation, that results from the activity of nervous system or endocrine system. So in extrinsic is the activity of nervous system or endocrine system that helps to regulate this internal environment. Homeostatic regulation involves uh, three units, which means this mechanism involves three units, which are the receptor, the control center, and the effector. So receptor is one that's, from the word receptor, that receive or sense the environmental change or stimulus. While the control center is one that when they receive it, they are the one that will now process the information supplied by the receptor and generate a response. And effector is one that will now respond to the command of the control center. Which, what am I trying to say here is that, for example, when there is an hot iron placed on your body, your skin is one that receives, that is the receptor. They are the one that contain a sensory receptor that receive the external stimulus of that hotness. But normally when something hot touches your skin, what happens is that you remove your skin. That is the response. But how does it occur? Before you remove your skin, or you remove the hot iron from your skin, it's something that's happened in between. When you receive it, the stimulus of that hotness, and also the response of removing your skin, that one is done by the control center. So that when the receptors receive the stimulus, the control center will now process the information supplied by the receptor, so that they now generate a response for you to tell you that that thing is what is very hot. So the effector is now the organ that will now move your body from the hot object. So, and there is a variation outside that desired range triggers an automatic response to correct the situation, which is called negative feedback. And that one will also what we are going to discuss in the next slide, which is a mechanism called a feedback mechanism. A feedback mechanism is a cycle or event that is continuously monitored, and information regarding this output is being fed back to the control center. And there are two types of feedback mechanism which we are going to discuss. We have the negative feedback and positive feedback. The negative feedback is one that is most common because it's one that makes help us to maintain any limit, so that when that thing is going higher they bring it down, because that if that thing is increasing it may affect the body, so they bring it down, and when it's getting more lower they also bring it up. That is why negative feedback is type of mechanism that reverses or opposes the original stimulus. If the original stimulus is to increase that thing from the normal limit, negative feedback will bring it down to the normal limit back. While we have the second mechanism called the positive feedback, and it's a type of mechanism that enhances or supports the original stimulus. So in this case, positive feedback is not always efficient in the body, because positive feedback occurs in a mechanism where that stimulus, if it increases, they also support its increment. Example of negative feedback is control body temperature. When the body temperature is higher, negative feedback will be the one that will be helpful at that moment, so that they will reduce the temperature. Not in this case of positive feedback, that high temperature, if it is positive feedback they continue to make it higher, which is not going to be good for the body. That is why negative feedback is one that is most efficient in homeostasis. But other example of negative feedback we have in the one I've mentioned earlier, the glucose level maintenance, uh, oxygen, blood pressure, and so on and so forth. But positive feedback, example of positive feedback is blood clotting, because when there is wound, blood will need to continue to gushes out from the wound until more platelets accumulate around that place. That's in that case positive feedback is very effective. And also during delivery, more release of oxytocin will causes it will also help in the ejection of the fetus from the uterus. An example of negative feedback in control body temperature. Looking at this diagram, the first you need to note is that homeostasis is the one that helps to control normal body temperature. When normal temperature is disturbed, that is a stimulus. That means there is a rise in body temperature. What sense it is receptor. That is why from this arrow, the homeostasis is normal body temperature. Now going to when there is high temperature, because the normal temperature has been disturbed. So the receptor will be the one that first notice this, and that is why all the temperature sensors in the skin and the hypothalamus will sense that there is an increase in body temperature. This message will go nowhere down except the control center, that is the brain. The brain is the one that contains a thermoregulatory center in the hypothalamus that will now receive the message from the receptor that there is high temperature in the body. So this information will now causes the control center to process the information and find a means to reduce the temperature. And the only means they have to reduce the temperature is to send the command to the effectors. So from the control center, the message the command now goes down to the effectors. So effectors will now be able to now act in such a way that they will help to reduce the temperature. How will they reduce it? Due to that high temperature, the sweat gland in the skin will now increase their secretion, so that they will now be secreting more uh, sweat that will help to reduce the body temperature, and also blood vessel in the skin will dilate. When this one has occurred, the normal temperature will now be restored. Thereby, they will now causes more heat loss through evaporation and increased heat loss through radiation. A typical example that I can give you is a hot rod in an iron in a fire. When you put water, you notice that there will be more steam coming out, thereby reducing the temperature of that rod that is just coming from the fire. So that is why The reason, the factor is also making sweat gland to be active in reducing temperature, that because of the high temperature they begin to release more sweat, so that that sweat will now be the one that will be reducing the temperature of the water in our body. And example of positive feedback, that is blood clotting. That is, which I said is positive feedback, sorry, in which the stimulus produce a response that also supports the original stimulus. For example, blood clotting is when there is a damage to blood vessel. So when there is damage to the blood vessel, there will not be, that blood vessel break and causes bleeding. That means blood will coming out. So these damaged cells around the blood vessel will now be the one that will now release chemicals, and these chemicals will now be the one that trigger the blood clotting to begins. How did they trigger it? Because of that damage, more blood will be coming out from this point of the damage where bleeding really is taking place. So the damaged cells around that area release the chemicals that enhances the clotting to begin. So as more blood is coming out, the clotting continue to uh, take place. So this clotting process now increases the release of more of the chemicals, so that more chemicals means accelerated clotting. So the more chemical is released, the more the clotting accelerates and the more the blood is releasing, until when this blood clot plugs is now formed around the vessel wall before the bleeding will stops, which means breakage in blood vessels that causes bleeding, more blood will begin to come out, and the more the blood is coming out, the more the cells that damage around the vessels releases chemicals. So more chemicals that is releasing, more clotting that is taking place, until when a clot plug is now formed around the vessels that break, that now closes it up before bleeding will stop. So you can now see the difference between the negative and positive feedback. In negative, when that thing is occurring, is taking place, negative feedback will opposite, they bring it down. But in positive feedback, when that thing is occurring, they continue to support it until they achieve their own mission too. So after we are through with homeostasis, the next thing is to discuss about body cavities. What are cavities? Cavities are potential space that contain or that contain or encloses organs in the body. So body cavities are internal chambers holding vital organs. Cavities, they are not that protect vital organs, and they allow organs to change in shape and size. So looking at our body, there are some potential space in our body that houses organs in the body. Example is our cranial cavity, which is found in the head, that houses the brain. We have the thoracic cavity in our chest that houses the heart, the lungs, the mediastinum, etc. We have the abdominal cavity that contain all our organs of the digestive system. And also we have the pelvic cavity that houses our reproductive organ. But there are two major body cavities. We have the dorsal body cavity that includes the cranial cavity and the spinal cavity, and also we have the ventral body cavity that includes the thoracic cavity and the abdominopelvic cavity. So this is diagram that shows us the body cavity. So as I said earlier, we have the dorsal cavity, which is the posterior, that contains the cranial cavity and spinal cavity, and we have the ventral body cavity, which is the anterior, that contains the thoracic cavity and the abdominopelvic cavity. So this is the cranial cavity, which is the space where we find our brain, and we have the spinal cavity, which is the one that encloses the spinal cord. So these two cavities forms the dorsal or posterior body cavity, and we have the anterior or ventral body cavity that contains that made up of the thoracic cavity, which is one that contains the heart and the lungs. So it's divided into two. We have the pleural cavity for the lungs and pericardial cavity for the heart. And also we have the abdominopelvic cavity that also comprises of two cavities. There we have the abdominal cavity that contains the abdominal organs, and pelvic cavity that contains the reproductive. So the first one is the thoracic cavity. As I said, it contains the heart and the lungs, and is subdivided into one, left and right pleural cavity, and each of the pleural cavity contains each of the lungs, because we also have two lungs, the left and the right lung. So each side of the pleural cavity contain each side of the lung, and they are lined by the visceral and parietal pleura. And also the mediastinum contains the pericardium, which is the pericardial cavity, another cellus membrane that surrounds the heart. The second cavity in the anterior is also the abdominopelvic cavity. From the word abdominopelvic is also formed by two cavities, and these cavities are lined by peritoneum. The first cavity is the abdominal cavity that extends from the diaphragm below the thoracic to the superior margin of the pelvis, so to the entrance of the pelvis. So the abdominal cavity contains the liver, stomach, spleen, and most of the large intestine, which means abdominal cavity contains majority of the organs of the digestive system. While the pelvic cavity is bordered by the pelvis with a floor of muscle and contains the reproductive organ majorly. Also we have urinary bladder and the final portion of larger. So that is just a brief about the body cavities. So another thing we are going to mention in our introduction are some of the terminology we need to know on anatomy. So what are some of those basic anatomical terminology? First thing, anatomical terminology introduces and make up a large part of medical terminology. But before we go to those terminology, what is the normal anatomical position? The anatomical position is a standardized method of observing or imaging the body that allow precise and consistent anatomical references. When they say anatomical position, what is the position you have to maintain to be able to allow a body to be well observed, or to allow imaging to take place, so that there will be a precise and consistent anatomical references. So this is a man standing in an anatomical position. Looking at this anatomical position, it means the subject stand erect facing the observer. The upper extremities, or that is the upper limb, are placed at the sides, the upper limb, and also the palms of the hand of the subject are turned forward, and the feet are flat on the floor. Also looking at this woman that have the two view, we have the anterior view facing the observer, and also the posterior view that's also backing the observer. It refers to the body position as if the person was standing upright. So if you look at this picture, they are standing upright with the head, the eyes, and the toes all directed anteriorly. You have the arms, which is the upper limb, adjacent to the sides with the palm facing anteriorly. And look at the lower limb, they are close together with the feet parallel, flat on the floor. That is the normal anatomical position. So some of the terminology that we are going to start with is the terminology of reclining position. So if the body is lying face down, this is what we call a prone position. When the body is lying face down, that is a prone position. And when the body is lying face up, that is opposite, it is in the supine position. So prone means when you lie down with your face facing down, that is prone position. But when you lie down and your face is up, that is a supine position. There are also some terms of relationship and comparison. So there will be diagram that we are going to use to explain some of the one that were listed here. We have the superior, also known as the crania, inferior or caudal, posterior, anterior, medial, lateral, dorsum, proximal, distal, superficial, intermediate, deep, and we have some combined terms like inferomedia, superomedia, anteromedia, etc. Looking at this diagram, we have the superior. The superior is one that means above, cranial, above, that is nearer to the head. That is why looking at the organ in the body, you can say our eyes is superior to our nose, because our eyes is more superior to the head, sorry, more nearer to the head than the nose. That is superior. While inferior means nearer to the feet. Anything that is more closer to the feet is inferior or caudal. You can also said our eyes is located inferior, so our nose is located inferior to the eye. That is, the one that is more closer to the floor is your nose. That is the nose that is now inferior to your eye. So that is the difference. So superior means above, close to the head. Inferior means below, closer to the feet. Also, we have posterior and anterior. As you mentioned in dorsal or ventral, posterior also means dorsal. Posterior means nearer to the back. So your back is posterior, while ventral or anterior means forward, in front. So we have in front, we have the anterior or ventral, while we have posterior, those are known as the back. Also, we have medial and lateral. Medial is the one that is very close. We know medial means the one that is very close to the midline of your body. So when you divide your body into two, we have the midline. That is the medial. While with the lateral is one that is very far from the midline. For example, when you are standing in an anatomical position, I said your palm will be facing forward. You know we have 5 fingers. If you look at your thumb and your smallest finger, that is the fifth finger, your thumb is more far from the midline. You can say the thumb, which is the first digit, is on the lateral, while your fifth digit is medial, because the fifth digit, which is the smallest, that small thumb, the small digit of your finger, is more close to your body than your thumb. So the thumb is lateral, while the fifth digit or your fifth finger is small. That small finger is now closer to your body. That is medial. Also, we have proximal or distal. So proximal is one that is very close to the trunk or point of organ, while distal is one that is far from point of organ. For example, when you are looking at your arm from the shoulder to your elbow, all the part of your arm at the upper part is proximal. That is one very close to your shoulder. That is proximal, because that one is very close to the trunk, to the joint of your organ. While the one that is at your elbow is now distal, because that one is far from the trunk. Also, we have the superficial, intermediate, and deep. That's when you make a cut. When you make a cut, you have the superficial cut, you have it at the middle, and you have the deep. So this is some of the terms of relationship and comparison, and we are going to make some illustrations in the class when we are discussing some of these terms of relationship and comparison. Also, we have the terms of laterality. When we said lateral means far from the midline. We can have two structures that are far from the midline. That is bilateral. Example, kidney are located far from the midline. That is why, and there are two structures. That's why we call them bilateral. Whereas those that occur on one side only are called unilateral. That is our spleen, as for example. But something occurring on the same side of the body as another structure is ipsilateral. For example, I said the right thumb is lateral. Also, the same thing, your big toe is also lateral. So they occur on the same side of the body. That's why we call them ipsilateral. And we have contralateral. That is what that occur on the opposite side of the body to another structure. That is why if you look at your right hand is contralateral to the left hand, because both your right hand and left hand, they are far from each other, but they are on the opposite side of themselves. That is why contralateral. While the one that on the same side that is still lateral is ipsilateral. Terms of movement. There are some movements that also occur in our body. We have flexion, that indicates a decreasing angle between the body or between the bones or part of the body. So flexion is when you move the part of the body, it it is formed by either bending or decreasing the angle between the bone. That is flexion. While dorsiflexion is the flexion, that one is also a flexion that lead to decreasing in the angle, but this one occur at the ankle joint, especially when walking uphill or lifting the toes off the ground. That is dorsiflexion. While plantar flexion is the one that occur when you turn the foot or toes towards the plantar surface. That is when standing on your toes. So when you are standing on your toes, that is plantar flexion. In that case, it's flattening out your ankle joint. That is the plantar flexion. But the opposite of flexion is extension. When we say flexion, indicates bending or decreasing the angle between the bones. Extension indicates straightening or increasing the angle between the bones or part of the body. So this is a diagram that shows us the flexion or extension of upper limb at shoulder joint and lower limb at hip joint. At shoulder joint, when you move your upper limb forward, that means the angle has decreased. That is flexion. But when you move it backward, that is extension at the shoulder joint. Also, so this is flexion when you move your hand forward, and this is extension when you move your hand backward. So you can see that at flexion the angle decreases, but at extension there is increase in the angle. Also at your hip joint, that is your waist, your hip joint, you also have the flexion and the extension. So the flexion is when you move your leg anteriorly forward to the front, still the same thing. Anteriorly forward front mean the same thing. So when you move your lower limb at your hip joint anteriorly, that is flexion. When you move it backward, that is when you are now standing on your toes at the back, that is extension. So this is one that shows the extension, in which your leg is now extending to the back, with that is an increasing angle. That is extension. You can also have a flexion and extension of your forearm at elbow joint, and also of your leg at knee joint. For your forearm, this is flexion when you lift your forearm up at and it's folded up, it folds at the elbow joint. That is flexion. In that case, you can see that the angle form a 90-degree between your arm and your forearm. That is flexion. But when you straighten your arm back, this is extension. You can see the angle has increased to 180 degree. That's why we said flexion indicates a decreasing angle between the bones, while the flexion indicates extension indicates an increasing angle. So flexion is when you lift it up at the elbow joint, the angle is 90 degree. That is flexion. When you straighten it out again, the angle increases to 180. That is extension. Also the same thing at your knee joint. When you lift your leg at knee joint, this is flexion. You can see the angle that is formed between your leg and your thigh at the knee joint is 90 degree. So when you are now standing erect again, that is extension. The angle has increased back to 180 degree. So you can also have a flexion and extension of vertebral column at intervertebral joint. So when you bend forward at your vertebral column, so this is flexion. When you bend forward, you can see the angle has decreased between your chest. That is flexion. But when you bend backward, that is when you have increased the angle. That is extension. Also we have the flexion and extension of your hand at wrist joint. So this is extension when you raise your hand up your hand at your wrist joint facing anteriorly, that is your flexion, extension. When you drop your hand at wrist joint, that is flexion. So all these one we are going to discuss them and also illustrate in the class using each individual in our class. So, and I mentioned one, we have the dorsiflexion and plantar flexion. So this flexion is when you raise your leg or your foot at the ankle joint, while the plantar flexion is when you stand on your toes, that is plantar. We also have abduction. Abduction is moving away from the median plane in frontal plane. That is when moving upper limb away from the side of the body, while the adduction is when you are moving an upper limb towards the side of your body. So abduction means abduction, moving away from the side of the body, while adduction is add. Adduction is when you move your limb towards the side of your body. But circumduction is the one that is circular movement that is now combining flexion, extension, abduction, and adduction, all the four movements together. And this one occur majorly at the hip joint. So it is the movement that occur in a circle. This is a movement, a diagram showing the different movements that we have. We have the first one, abduction. Abduction, as I said, is when you are moving your limb away from your body. As you are moving away from your body, that is abduction. You are moving it away. But when you are moving it closer to your body again, we have adduction. So we can have this one at the upper limb. Also, we have at your lower limb, abduction. When you are moving your leg away from your body, that is when you are opening your leg. That is abduction. When you are closing your leg again, moving it closer, that is adduction. And you can also have a medial and lateral rotation of both your arm. So you also have abduction and adduction in your between your fingers. You can open your fingers, abduction. You can add them together again, that is adduction. You can also rotate your fingers among themselves, that is lateral abduction and medial abduction. So these are the movements that occur between our bones or within part of our body, and this one will be well illustrated when we are in class. So we also have pronation and supination. Pronation is the rotational movement of the forearm and hand that swing the radius medially around its longitudinal axis, so that the palm of the hand faces posteriorly and its dorsum faces anteriorly. So when you turn your hand, in which your palm of the hand now faces posteriorly to the back again, you know the normal anatomical position is the palm facing anteriorly. So when the palm of the hand is now facing posteriorly and its dorsum is now facing anteriorly, that is pronation. But when you are standing in anatomical position again, when you now turn your palm of the hand to face anteriorly again with your hand faces posteriorly, that is supination. That is that one. Also, we have opposition and reposition. Opposition is a movement by which the pad of the first digit is brought to another digit pad. That is when this is opposition, and this movement is used to pinch a button, a shirt, and also to lift a teacup. So when you pinch someone, that's why you use your first digit with another digit. You can pinch someone. That is opposition. But reposition is the one that describes the movement of the first digit from the position of opposition back to its normal position. So after you are through with pinching someone, when you return your hand back to its position, that is reposition. So position is when you brought the first digit of your hand to another digit, that is opposition. So you can use it to pinch someone. When you are buttoning your shirt, that movement between your two fingers is opposition. And when you are lifting a teacup by the handle, that's also opposition. But when you are returning them back, that is reposition. Also, we have protrusion. That is the movement anteriorly, as in protruding the mandible. So when you protrude your mandible out, that is protrusion. But when you move them back again to the normal position, that is retrusion. Also, we have the similar terms. We have the protraction and retraction. These are usually most commonly used for anterior and posterior movement of the shoulder. So when you move your shoulder anteriorly, that is protraction. When you move it backward, that is retraction. So all this one will be illustrated in our class, but just look at the diagram to be able to understand what the concept they are trying to explain to us. Also, we have elevation. Elevation is when you raise or move a part superiorly, as in elevating the shoulder. So when you are shrugging, that is elevation of your shoulder. You can see from the diagram elevation with the one that is with the blue arrow, showing that the shoulder is being elevated upward. Or you can also do elevation, that is when the upper lid, that is when opening the eye. When you lift up your eyelid, that is elevation, in order to open your eye. And you can also elevate your tongue when pushing it up against the palate, that is elevation. While depression is when you know that anything that goes up, it surely come down. So when you elevate your shoulder, that is elevation. When you lower it back, that is depression. That's when you stand at ease, that is depression. We said elevation is when you elevate your upper eyelid to open your eye, that is elevation. When you depress it down to close your eye, that is also depression. We said elevation is when you elevate your tongue when pushing it against the palate. When you are pulling your tongue away from the palate, it's also depression. So elevation and depression is opposite of each other. Also, we have rotation, which is the turning or revolving a part of the body around its longitudinal axis, such as turning one head to face sideways. So when you turn your head sideways, that is rotation. And we have two types of rotation. We have the medial one and we have the lateral one. Medial is when you rotate your body towards the middle of your body, that is rotation, medial rotation. But when you rotate your body away from the middle of your body, that is lateral rotation. And also we have some regional names. So these are the names that are given to specific regions of the body for references. Example include crania. Crania means skull. Thoracic means chest. Brachia, your arm. We have patella, or your knee. Cephalic, head. Glutea, buttock. We have antebrachia, forearm, and so on and so on. So this is the end of the second lecture video on introduction to anatomy and physiology. So as we await the last part of the introduction to anatomy and physiology, please try and master some of the terms to be able to illustrate. But we are going to also explain this one better by taking some of our member of our class to show us some of these illustrations they have watched, so that we're able to get ourselves conversant with them. Thank you for listening.